Hello and welcome to Ideagen TV, powered by Azure, presented globally by Microsoft. Today, we are honored and very excited to welcome back to Ideagen TV a good friend, BJ Moore, the Executive Vice President and CIO of Providence Health. BJ, welcome.
Thank you, Christian. Really appreciate it. Great to be here. So moving on to something near and dear to my heart. COVID has showed how important it is to have access to data. Tell us about the future of data in advancing healthcare and preparing for the next pandemic.
Right, as I kind of alluded to, I think BJ, it was fantastic. It was providential for us that we got you here 2 years ago, because we really understood that the secret is both to get the systems aligned the right way, and then the output from that is this extensive amount of data. And the more data you have, the better able you are to use it and to find and discover answers. And we really learned this as we put together COVID-19. And your team was able to stand us up quickly, get everything hooked up together. But now, as we run through this next phase, we're kind of looking at how do you bring and aggregate data from all around the country, from different health systems, into one unified area, so that all the data scientists in the country and all of the other researchers can look at this massive data. And the more data you have, the clearer the picture gets. It's counterintuitive, but the more it's like a Hubble telescope that's looking at galaxies, and all of a sudden you understand patterns that weren't there before. This wasn't, we weren't capable of this back, a number of years in my career, because we didn't have the power to compute fast enough. Now that we have that, we can put all this together. And it's probably the, what we say, we have the statement that data will save lives. And we strongly believe that. And I think that's the next exciting era that the next 5 to 10 years are going to bring us.
Yeah, I just think about in March when the pandemic was really getting into full gear and our reporting and visibility was limited, and how quickly we moved and managing precious things like PPE and ventilators, and then evolving to the point where we were beginning to have forecasting models for COVID and where we thought it would pop up. And so went from being fairly blind to April, May, oh my gosh, we have this crystal ball we didn't think was possible. And I, saw firsthand how it changed the way we made decisions and the way we delivered care. So I think it's just the tip of the iceberg. I think it's one of the good stories that come out of COVID and showing what can be done with data and machine learning and artificial intelligence.
And I think it's both the data and the collaboration that comes along with the data, because all of a sudden we had data scientists from all around the country talking about the issues, thinking about it. And that collective power is extraordinary. So it's the data itself, and then it's the aggregation of the people and the folks working together on that data.
So this one a lot of things keep me up at night. This is one of them. Healthcare in the U.S. saw major cybersecurity breaches this year. How significant of an issue is this in your mind?
Well, I gave a talk, and I keep referencing it because I occasionally get it right. It was about 4 years ago, and I gave a talk and said the two things that worried me the most were viruses. One are cyber viruses, and everyone nodded their head. I think at least they understood that. I don't think they quite understood the magnitude issue. And I said the second were RNA viruses, and people just kind of looked at me like, really? What's that? And I talked about SARS, and I talked about MERS and other things, but I don't think I quite got it. But today, if you ask me, that is as relevant an answer as if ever. And I think both have been ramped up substantially. I think the whole cyber area, you're the expert, but wow, I takes your breath away. And also just that bad actors have advantaged this time during COVID to really, up the game. And we've seen it in government, we've seen it in banking, we've seen it in healthcare.
Yep.
So I think this is one, that is a national emergency and really requires that we kind of put our shoulders behind that one. But I'm just as worried. I'm a little less worried because I know I've got you on my flank. But it's a tall order. I think, BJ, how many in general, how many cyber attacks does a healthcare system get a day? I mean,
I think attempted attacks are measured in the thousands. Those thousands never make it past the outer perimeter. So we've got automated systems that take care of that. I'd say about once every 3 months, somebody gets in the walls before we stop them. And then, knock on wood, we've been able to stop them at that point in time. But yeah, it's thousands, tens of thousands of attacks every day. I mean, they're constantly, testing our perimeter. And it's unfortunate. You would think in the pandemic would be a time that maybe somebody would realize now is not the time to attack our health system. But we saw a 5x increase during the pandemic. Not only was it high before, it actually increased during the pandemic. So really disconcerting, the bad actors out there trying to do harm. Earlier, you also mentioned that climate change is one of the challenges ahead. What is the effect of climate change on health, and what is Providence doing about it?
There are two aspects to climate change for Providence. Last year we made a commitment in 2030 to be carbon neutral. And most people say, well, healthcare and carbon neutrality, but we are one of the high users of energy costs. We're a 24/7 operation. And things that I learned as I got into this topic, like anesthesia gases and their effect on the environment, and which ones should we use or shouldn't use. So healthcare itself has a real big obligation in the whole area of the environment. Then the second part is that in healthcare, we deal with the consequences of the environment, with asthmatics and other pulmonary disorders that are out there, the effects of the environment and cancer that we're seeing. So we see the long-term side effects of environmental change become part of what we have to do with. And I think that we're worried about with climate change in general, its effect on food sources, et cetera. I could go on and on. So there's a big connection between healthcare and climate change and the importance of that. So we see this as an important issue as a health system, both as clinicians and as a user of resources, and how do we deal with those as we go forward. So it's something that our people are really committed to. I think most organizations, there's a sense of this is what we should be doing, and I think it's an obligation that we have to the rest of the country to jump into this area.
And I'm excited. Back in August, you actually moved real estate and facilities under me, and I think there's a real opportunity with technology to both get more efficiency in the facilities we have, but also use technology to become more elastic in the way that we use the resources we already have in place.
Absolutely, and I think BJ, you're putting your thought to how does technology really help us? What's the footprint of real estate that we really need? Let's just think about our carbon footprint. And I know I have a lot of friends in the airline industry, but from an environmental standpoint, Providence itself could reduce its carbon footprint by reducing its number of airline miles that it puts in.
In telehealth, you mentioned we ramped up to 10,000 visits a day, right? Think about how many clinics we won't have to build in the future if we're able to deliver a lot of that care virtually. So we can have that expansion of care delivery, but without building buildings. So yeah, I really see the two working hand in hand.
Absolutely.
Well, I think you got a new exciting role in January. Let me congratulate you. You're the new chair of the American Hospital Association. Congratulations.
Right.
I know you didn't have enough on your plate, but it was good that we added more. So what excites you most about this new role?
So I think I've been on the board of the American Hospital Association for 4 years, and this year I stepped into the chairpersonship at an interesting time, to say the least. I think what's most exciting is being able to be in a position to try to affect policy with our wonderful CEO, Rick Pollack, and try to put pressure, on a national level on issues that we think are most important. One of those issues that we've highlighted is rural healthcare, that we're, particularly with the COVID-19 pandemic, we're concerned about the future of rural healthcare. And I think from the AHA, we're in a position where we can influence that substantially. And obviously, all the policy issues now that there's a new administration, a new Senate, what are the directions that we're going to take as it relates to the ACA? And in general, we have always been committed to full coverage of all Americans in some way, an expansion of the ACA. So I think we'll be able to move along that pathway as we go forward. So that's what's exciting, and to be able to influence that at a national level. The other part is also to have a respect for the diversity of the hospitals, the geography of this country. When I'm on a board meeting, I've got colleagues from Nebraska, from Maine, from California, and we all come together with one thing in mind. What's the best health for the country? And it's amazing, at least maybe it's healthcare people, but regardless of some of our political differences and other regional differences, we're able to come together on, looking at what's in the best interest of our communities and our patients.
Yeah, and I really want to highlight that. I see that at Providence and COVID and the collaboration that I've seen. Everybody really puts that patient at the center, right? What is right for the patient? So like you said, political differences, all those things just disappear and the patient becomes the focus.
Yeah, absolutely. So it'll be an interesting year. Then I have one more year as the past chair, but definitely in the hot seat now, and let's go get them. This is the year to make some changes, do some things that we've always needed to do. And what I always like to see, let's accelerate out of COVID into a better place.
And take the building blocks that were built during COVID, as you mentioned earlier, that make us stronger.
Absolutely. Absolutely.
So final question, what is the best piece of advice you've ever received about resiliency, and who did you receive it from?
Well, that's a great question. To me, it's always about resiliency. And I think it came from my parents, right? I always think back to them. I'm the son of two immigrants that came to this great country in 1950 and had absolutely nothing, and were able to make a life, get their two kids through college and med school and everything else. And it taught me that regardless of the circumstances, you get yourself up, you keep driving your legs. It's like that running back, keep those legs moving, and you're going to get there. And life is always going to be one where you're going to be knocked down. And the question is not whether you get knocked down, it's just how you get up. And to me, I think learning it early was the best thing for me. And 42 years later, after graduating medical school, it's still working. And you better have that kind of an attitude if you're going to be in healthcare. Yeah,
excellent. Well, thank you, Rod. Excellent discussion today. Really appreciate it. And like I said, it's been an amazing 2-year journey. Year one was good. Year two was even better. I really feel like I've had a great impact and really appreciate your leadership and really proud of what Providence has done.
And I would say, BJ, it's nothing like having a co-pilot like yourself. And, I just think, information technology is so critical to the success of a healthcare system. And, you and I work closely together. And I think that makes all the difference too, that, we know how important this is. And it's the teamwork between the CIO and the CEO that makes a difference. So I'm glad to have you. I sleep better at night knowing that.
Thanks, Fred. Appreciate it.
Great.